Hi, you're welcome to another episode of our Q&A Saturdays. And if you're new on this channel, you're welcome to my channel. I am Pharmacist Charity Amaka. I make posts on health, motherhood, and lifestyle. And then every Saturdays, I answer questions from my viewers. So you're welcome. In today's episode, I gathered some frequently asked questions on cesarean section delivery. Questions like, when should I start trying to conceive again after having a CS delivery? Is it possible to have a vaginal delivery after a previous cesarean section? And how many CS sections are safe? Like, what is the safety of multiple cesarean sections? So we'll be discussing all of this today. So stay with us as we break down these critical topics and give you the answers you need to make informed choices about your childbirth options. So let's get started. Okay, the first question we'll be discussing today is, when should I start trying to conceive again after having a cesarean section delivery? It is generally recommended that you wait for about 18 to 24 months after a CS delivery before trying to conceive again, especially if you want to try vaginal births in your next pregnancy. This 18 to 24 months waiting period gives your body an ample time to heal and recover. And it comes with lots of advantages, which I'll be sharing with you today. Advantages like, one, uterine healing. That is proper healing of the womb. Your uterus needs lots of time to heal from that incision that was made during that cesarean section delivery. And adequate healing of the uterus reduces the risk of some complications in future pregnancies. Complications like uterine rupture, where the uterus tears open from that line, that scar line from the previous year's delivery. So giving your body ample time to heal will prevent and save you from the risk of this complication. The second advantage that comes with this waiting period is what we call scar tissue formation. After a cesarean section, scar tissue forms on the uterus, and that waiting period allows that scar tissue that forms in the uterus to strengthen and integrate properly, which can help to prevent issues in future pregnancies and deliveries. The third advantage is reduced risk of complications. Just like I mentioned earlier, waiting allows time for the risk of complications. Complications like placenta previa, where the placenta covers the cervix. So waiting allows time for the risk of such complications to be lowered in subsequent pregnancies. The fourth advantage is reduced risk of preterm birth. Shorter intervals between pregnancies after a cesarean section can increase the risk of preterm birth. So waiting longer helps to ensure that the baby is more likely to be born at full term. But also you have to remember that individual circumstances can vary, in the sense that some people might actually be required to even stay longer than 24 months before trying to conceive again. So it is important to consult with your healthcare provider to determine the best timing for you based on your specific health and recovery. Okay? Alright, so let's move to the next question for today. The second question says, how possible is it to have a vaginal birth after a cesarean section? It is possible. It is very possible to have a vaginal birth after a cesarean section, what is commonly called VBAC, vaginal birth after cesarean. Many women who have had a cesarean can successfully have a VBAC. I'll be using VBAC. You already know the meaning, right? So many women who have had a cesarean can successfully have a VBAC, but it depends on several factors as well. Factors like, one, the number of times you have had a cesarean section in the past. Yes, that is a very important factor. So now, listen. if you have had a cesarean section more than once, listen, oh, if you have had a CS more than once in the past, please, I beg you in the name of God, do not try VBAC. Do not even be tempted to try a VBAC. Just go for elective CS. Yes, this is to avoid the risk of uterine rupture, because the contraction and all that comes with VBAC might cause the uterus to tear open along that scar line from your previous cesarean deliveries. So please, do not attempt a VBAC if you already have more than one cesarean section delivery. Second factor is the type of cesarean incision. Yes, the type of incision you had in your previous cesarean section delivery. This is also an important factor because a low transverse incision, that is a horizontal incision, which is actually the most popular, is more favorable for a VBAC than a vertical incision. A vertical incision may carry higher risk when it comes to VBAC. Now, the other factor is the reason behind your previous cesarean section deliveries. If the reasons for your previous cesarean delivery are not likely to reoccur, if they are not likely to happen again, then VBAC might be a good option. Reasons like fetal distress. If the cause of the distress was specific to that pregnancy, it might not necessarily reoccur in subsequent pregnancies, so VBAC is possible. But if the cause is something that can reoccur, like placenta previa, although it may or it may not reoccur, so if it reoccurs, then VBAC will not be possible. And also there is what we call cephalopelvic disproportion. That is a situation where the pelvis is too small to allow vaginal birth. So if that is your own case, then VBAC will not also be possible. A repeat CS would be the safer option for you. And also, cases like maternal health conditions, where we have hypertension or diabetes in pregnancy, if such cases reoccurs in your subsequent pregnancies, then you also have to be going for a repeat CS. VBAC will not be an option. But then, in all of this, if you qualify for a VBAC, please ensure that the hospital where you plan to deliver is well equipped to handle an emergency cesarean section just in case the need arises. Okay? Alright. The next and last question for today says, how many cesarean sections can one safely have? Research hasn't established the exact number of C-sections considered safe, but women who have multiple repeats of cesarean deliveries are at increased risk. So the higher you go, the higher the risk. Yes, most doctors recommend being extra cautious and careful after 3 to 4 cesareans. And this is due to the increased risk of uterine rupture, scar tissue, and placental problems that arises with each cesarean delivery. So you're advised to limit the number of cesarean sections to minimize these risks associated with multiple surgeries. And you're also advised to wait for 18 to 24 months between cesarean deliveries. This waiting period will allow your body to heal properly and also prevent these complications in future pregnancies. And it is also important to discuss your individual situation with your healthcare provider so that you'll be given a personalized advice based on your health, the number of your previous cesareans, and your future family planning goals. Okay? Alright, thank you for joining me today as we explored CS, VBAC, and everything in between. I hope today's discussion has given you the clarity and confidence to make the best decisions on your childbirth journey. Remember that every pregnancy and delivery is unique, so always consult your healthcare provider to find the safest and suitable options for you. If you found this video helpful, don't forget to like, share this video and subscribe to this channel for more insights. And if you have more questions or topics you'd like us to cover in future episodes, please drop them in the comment section. Thank you. Until next time, take care and stay informed. Bye.